Still in the series of the cranial nerves, in this part we are going to describe the trigeminal nerve, one of the largest cranial nerves in the body. So about the trigeminal, we'll do the same. We have to know the function and the deep origin of such large nerve. So for the function, it has two functions. General somatic afferent fibers going to the mesencephalic nucleus, that is the one in the midbrain, the main sensory nucleus, which lies in the bones, and the spinal nucleus of trigeminal, which lies in the medulla oblongata. The second function is special visceral efferent to the muscles of the first pharyngeal arch, and this from the motor nucleus of the trigeminal nerve. For the superficial origin, that is the largest cranial nerve here, the number 5, the trigeminal, which take origin superficially from the ventral surface of the bones at the origin of the middle cerebellar peduncle. Next, we are going to do the course and relation of such nerve. In short, it's a very short trunk formed of this small motor and large sensory roots. It comes from the semilunar ganglion, which lies on the apex of the petrous part of the temporal bone, covered by a dura mater called cavum trigeminal. To the convex surface of the ganglion, it gives the three branches, which are the ophthalmic, the maxillary, and the mandibular nerve, which the only nerve joined by the motor root. The trigeminal nerve is responsible for the supply of the face here, and these are the areas supplied by the three branches of it. By the first division, the ophthalmic, this is the area in light yellow, and this is the second one area, which is the maxillary, light blue, and the last one is the mandibular area, which is by light pink. But remember, there is some overlap between the different areas of the branches of the maxillary and the face. But importantly is to remember that the angle of the mandible, this area here, is supplied by the great auricular nerve from the second cervical segment. So the whole face by the trigeminal except that one by the second cervical. Let's start by the large nerve, the first division, which is the ophthalmic division of the oculomotor. And that part of the nerve, its function is pure sensory. Its course and relation is related to the orbit. This is the smallest of the three branches. We have seen it in the lateral wall of the cavernous sinus, below the trochlear nerve, and above the maxillary nerve. Just before it enters the orbit, through the supraorbital fissure, it is divided into three branches, which are the lacrimal, that is the most lateral one, which is close to the lacrimal gland, the frontal, which passes under the roof of the orbit, as we have seen it in the previous diagrams, and the last one is the nasociliary nerve, which is the most medial division. So you got lacrimal, frontal, and nasociliary. That is the nasociliary. Let's start by the frontal. The frontal, the first branch is the lacrimal nerve, and this is the smallest one of the branch of the ophthalmic, and it enters the orbit through the lateral part of the supraorbital fissure outside the tendinous ring, pass along the lateral wall of the orbit above the lateral rectus with the lacrimal artery. Receive communication, parasympathetic fiber from the ligamentotemporal nerve, which carries secretory fibers to the lacrimal gland, as you can see here, that is the lacrimal gland. Some fibers are going to the gland, the parasympathetic, and it ends by supplying a palpebral branch to the upper eyelid. That is the palpebral branch going to the upper eyelid. The second branch is the frontal nerve, that is the second one, which is the largest of the three, enter through the suborbital fissure like the others, outside the common tendinous ring, just medial to the lacrimal nerve. In the orbit, it runs directly below the roof, the bony roof of the orbit, above the muscle, the levator palpebrae superioris, then end by dividing into two branches, supratrochlear and supraorbital, and both of them go to the face and scalp. And they supply also the frontal ear sinuses. The last branch, which is the largest one of them in branching, that is the nasociliary, enter the orbit through the suborbital fissure inside the common tendinous ring between the two branches or two divisions of the oculomotor, the third nerve, crosses the optic nerve from lateral to medial, below the superior oblique, above the medial rectus. So it lies in the right side of the orbital cavity between the superior oblique and the medial rectus muscles. Ends by giving the branches. The first branch is the sensory branch with the ciliary ganglion. This carries sympathetic, parasympathetic fibers, which are the short ciliary supplying the ciliary and the pupillary muscles. Long ciliary nerves, more than one, which supply somatic sensory supply to the eyeball, and the infratrochlear nerve, which supply the lower eyelid and the face. The next branch of the nasociliary is the posterior ethmoidal. That posterior ethmoidal nerve will pass through the posterior ethmoidal canal to supply the ethmoidal and sphenoidal air sinuses. And then the anterior ethmoidal, the last branch, anterior ethmoidal nerve, and this nerve will pass through the anterior ethmoidal canal to reach the cranial cavity on a slit on the lateral side of the ethmoid to re-enter the nasal cavity, where we call it the internal nasal, and then it will supply the nose, inside of the nose, and by giving what we call it external nasal to the skin of the nose. These are the branches of the nasociliary branch of the ophthalmic. Now to the maxillary nerve, the second one. Again, it is a pure sensory, general somatic afferent fibers only, that is the function. Its course and relation is very interesting as it passes through all bony spaces, starting by leaving the cranial cavity through the foramen rotundum to reach the trigopalatine fossa. From that fossa through the trigomaxillary fissure, it will reach the infratemporal fossa, bends to enter the inferior orbital fissure, and continues in the infraorbital groove, then infraorbital canal found in the floor of the orbit, then exit outside to the face through the infraorbital foramen. So it passes all of these bony spaces. The branches of the maxillary nerve in the cranial cavity will give the meningeal branch, which supply the outer layer of the dura mater, and in the trigopalatine fossa on the back of the maxilla, it will give the ganglionic branch to the sphenopalatine ganglion, and these are the somatic sensation. Sensory branch, the trigopalatine ganglion. Then it will give a zygomatic nerve in the fossa, which will divide into zygomaticotemporal and zygomaticofacial nerves. From the zygomaticotemporal, some parasympathetic fibers from the ganglia will pass through the zygomaticotemporal to the lacrimal nerve, to the lacrimal gland. The other branches are The posterior superior alveoli is still in the trigopalatine fossa, and these are on the back of the maxilla. You'll find some small foramina, more than one, which pierce the infratemporal surface of the maxilla to supply the maxillary air sinus, the molar teeth, and give branch to the cheek and gum. While in the infraorbital canal, we name it the infraorbital nerve. That is the one here, which will give the middle superior alveolar to the upper premolar teeth, anterior superior alveolar to the canine and incisor teeth, and sends nasal branch to the nasal septum. In the face, the infraorbital nerve will end by giving palpebral to the lower eyelid, nasal to the side of the nose, and labial to the superior, to the upper lip. That's the superior labial. Here is two interesting cadaveric specimens for the maxillary nerve. You can see the maxillary sinus. Above it here is the infraorbital canal here. And that is the what we can see here. That is the area which you enlarge on the right side. That is the maxillary artery. That is the one here, the maxillary artery. Then that is the zygomatic nerve here going. That is the one going to one of the two branches of the zygomatic. This zygomatic will divide in zygomatic temporal and zygomatic facial. That is the zygomatic temporal branch of it. Then that is the infraorbital nerve passing in the infraorbital canal, as we said here. And then that is the anterior superior alveolar nerve, which come out from the infraorbital nerve. And that is the posterior superior alveolar, which comes in the trigopalatine fossa. That is the trigopalatine fossa here. The main maxillary nerve will be over here, and this is the posterior superior alveolar nerve. Here is the fibers going to the lacrimal gland coming from the zygomatic temporal. And this is the maxillary air sinus on both sides. Another interesting cadaveric photo for the maxillary nerve itself within the trigopalatine fossa. Here again, we enlarged this part here on the right side. That is the part here which is enlarged. You can see here the maxillary division itself. Here you can see the nerve pterygoid canal, which carries the sympathetic and the parasympathetic roots for the sphenopalatine ganglion. That is the sphenopalatine ganglion here, this one. And then that is the posterior superior alveolar. And then continue at the infraorbital nerve here. That is the pharyngeal branch, which goes to the pharynx from the ganglion. That is the ganglion itself here. That is the ganglion. Out of the ganglion, there is the lesser and the greater palatine nerves. That's very interesting diagram, not a diagram, a cadaveric picture of the maxillary nerve, which is very informative and very rare actually. That is the both lesser and the greater palatine nerves. Now to the last branch of the trigeminal nerve, the mandibular nerve. That is the mandibular nerve here, which you can see it. That is the posterior division actually, but it is the large one, and the anterior division is a small branches, as we will see, but this is the main trunk coming out from the cranial cavity here. The function of this part is make general somatic afferent to most of the face and head and neck, and special visceral efferent to the muscles of the first pharyngeal arch. The course and relation of this nerve is the largest of the trigeminal nerve branch, formed of two roots, large sensory and small motor, leave the skull through the foramen ovale to the infratemporal fossa, that is the infratemporal fossa here, where the two roots unite to form the nerve trunk. The trunk lies medial to the lateral pterygoid, the one which you can see here, that is the lateral pterygoid, the cut edge here, which will continue to the neck of the mandible here, and the medial pterygoid, it lies on the medial pterygoid, so it will be covered by the lateral pterygoid and lies on the medial pterygoid. That is the position of the nerve when it comes out from the cavity. That is the medial pterygoid here. It's a very short trunk which divides immediately into anterior and posterior division. That's a very simple diagram to show the branches of such nerve. That's from the trunk here, the main trunk. It gives off two branches, which are the nervus spinosus, better call it meningeal, supply the outer layer of the dura mater, and pass through the foramen spinosum to the cranial cavity. The medial pterygoid branch to medial pterygoid, that is the medial pterygoid, that's the nerve to medial pterygoid, supplying that muscle, but it will give a branch which goes to the aortic ganglion without relay, being a motor nerve, of course. It will end by supplying two muscles, the tensor palatii and the tensor tympani muscles. All these muscles, as we said, are derivatives of the first pharyngeal arch. The other branches are from the anterior division, and all of them are muscular. One to the temporalis muscle, one to the lateral pterygoid, and one to the masseteric nerves to the masseter. And that is the anterior division, give only one sensory nerve, which is the buccal nerve, supply the skin over the cheek in the face. Lastly, the branches of the posterior division, which are three, the auriculotemporal nerve, and this nerve have two roots around the middle meningeal artery, and then it passes deep to the neck of the mandible, very close to the neck, and this is very important to remember, within the substance of the parotid, to leave the gland to the upper end to the scalp. It carries both excretory motor fibers from the otic to the parotid to the from the otic ganglion to the parotid gland. It is sensory to the external acoustic meatus, articular to the temporomandibular joint, and superficial temporal to the scalp, supplying the skin of the scalp. Here is a good one showing the lingual nerve of the posterior division, one of the largest, two large branches of the posterior division, the lingual and the inferior alveolar. This is the lingual nerve, which is joined by the chorda tympani. If you can look carefully here, that is the chorda tympani shown here, coming from the trigopalatine, from the vitrosquamous fissure to join the lingual nerve over here. You can see the tiny nerve here. This is the chorda tympani. Descends down between the medial pterygoid and the ramus of the mandible. That is the medial pterygoid here and the ramus of the mandible. Then lies behind the root of the third molar tooth. That is the dangerous position, where it's only covered by mucous membrane and could be injured during extraction of such tooth. Reaching the submandibular region, it passes between the mylohyoid laterally and hyoglossus deep to the submandibular gland. This will be done with this region, the submandibular region. It ends by supplying submandibular here, that is the lingual again, where it reaches the submandibular region, it will curve around the submandibular duct, which you can see it here. That is the submandibular duct. And then its terminal branches carry sensation from the mucous membrane of the mouth, from the gum, the anterior third of the tongue, that's a somatic sensation. The chorda tympani will supply parasympathetic to the submandibular secretory motor fibers and the sublingual, that is the sublingual here, and carries fibers, taste fibers from the anterior two-thirds of the tongue. That is the lingual. The other one is the inferior alveolar nerve, a very large branch. You can see it here outside in the same position of the lingual, and then continuing in the mandibular canal here. That is the inferior alveolar, descend deep to the lateral pterygoid. That is the lateral pterygoid again, which will be coming like that. So it will be deep to that muscle on the surface of the medial pterygoid, like the trunk itself. And then lies between the ramus of the mandible and the medial pterygoid. That is, the medial pterygoid and the ramus, it will lie between the ramus and the medial pterygoid and runs in the canal as far as its end, the mental foramen, where it divides into mental to the skin of the face at the chin and the incisive branches. Before it enters the mandibular canal, it gives the mylohyoid nerve. You can see it here. Before it enters, you can see it here in the submandibular region, which pierces the sphenomandibular ligament, that mylohyoid nerve, down in the groove of the medial side of the ramus of the mandible, very clear there, and end by supplying the mylohyoid and the anterior belly of the digastric. That is the inferior alveoli. That's a final summary of the branches of the mandibular nerve as a whole. From the trunk, as we said, you got the nerve to medial pterygoid, which give branch to the otic ganglion, which will supply the tensor tympani and tensor palatii and the medial pterygoid. Then the nervus spinosus to the dura. Anterior division will give 3 muscular branches to the lateral pterygoid, to the temporalis, to the masseter, and 1 sensory, which is the buccal nerve. The posterior division gives 3 branches, which are the lingual, the large one, the inferior alveolar, and lastly, the auriculotemporal nerve. These are the branches of the mandibular nerve, and this finishes with the trigeminal. Thank you.